Report configuration. Before we get into the details of various settings that affect the appearance of the EMG report, let's look at the structure of the report. The report is generated using Microsoft Word. At the beginning of the page, we have the so-called page header or the document header. It contains the name of the patient ID, and the date and time of study. Next, we have the report header. This contains the information about the testing center, the name of the facility, their address and contact information, and so on. Next, we have the patient information, the patient name, ID, gender, date of birth. This is the information that is not going to change when the patient is seen on multiple occasions. This is followed by the visit information. The visit information contains details about this specific electrodiagnostic study, and hence it has information such as the examining physician, the referring physician, today's height and weight, and the complaints. We have a section for automatic summary. Based on the nerve conduction measurements made on the patient and using the reference values that are programmed in the system, one can automatically generate the summary of findings. So in this case, we have findings on motor nerve conduction studies, which were normal in all 4 tested nerves, and the nerves are listed. And similarly, we have a section for the sensory nerve conduction, F wave, and the needle EMG. And we did have some abnormalities in the needle EMG, and this is also indicated using the bullet point. Next, we have a section for the narrative section of the report. This contains the conclusion, recommendation, etc. Some laboratories prefer not to use automatic summary. So it is in this section that they will describe the findings of nerve conduction and EMG in their own words. So this is called the report signature section. Next, we have the tabulated data. We have the measurements from the sensory nerve conduction studies. Then we have the motor nerve conduction studies, F wave, and the needle EMG summary table. Note that in this report we have highlighted the muscle with abnormal findings with a yellow background. Since the nerve conduction studies were normal, we do not have any yellow highlight in the nerve conduction table, but it is possible that if the conduction studies were abnormal, they can also appear with a yellow highlight. We have a page break, and then we have waveforms. Initially, we have 2 images of waveforms that were transferred manually during the needle EMG examination. This is followed by the traces that were recorded in the nerve conduction study, and they were transferred automatically into the report. So these are the general sections of the report. Obviously, depending upon the testing, it may contain more sections or fewer sections. Let us now look at some of the important settings of the report generator that will affect the layout and appearance of the report. To access the report configuration settings, click on Edit, User Setup, and Report Setup. Let's look at the contents of the General tab. The page header contains the patient name, patient ID, and date of study. This can be shown on all pages, as we did in our sample report, or we can show it on all pages except the first, or we can turn it off altogether. The default setting is all pages. The EMG summary table can be shown in landscape mode. This is useful when the table has many columns and long phrases to describe the normal and abnormal findings. The abnormal muscle names and abnormal findings can be highlighted in yellow background, as we saw in our report. If we do not wish to use any highlight, this setting should be disabled. Our report contained the name of the muscle. If you also would like to have information about the nerve and the roots that supply that muscle, enable this setting. The default setting is to highlight the abnormal findings. The automatic summary is generated using the user-defined reference values and findings in the patient nerve conduction studies. Some laboratories like to narrate these findings in their own words. To disable this section, uncheck this setting. The default setting in the system is with the auto summary turned on. Let us look at the header tab. This will allow us to change the report header file. The report header file contains information about the laboratory, the name, address, and so forth. Changing this information is described in a separate video. Here is the signature tab, which will allow us to change the report signature. The report signature file contains various headings of the narrative. It contains the examining physician name, etc. Again, editing these contents is described in a separate video. We will not discuss the patient demographic and visit information using Microsoft Word tables. It's a rather advanced setting and it is not used in most places. Let us now look at the sequence tab. As we indicated earlier, a report has got many sections. Using this tab, we can change the order in which various sections appear in the report. So in this example, we have the report header at the beginning. This is followed by the patient demographic, visit information, referral information. Then we had the auto summary and the signature. The arrow to the left indicates that there is a page break, and then we have the tabulated data. First we have the sensory nerve conduction, then motor and F wave. Let's say I would like to have the motor nerve conduction data to appear before sensory nerve conduction. I can click on motor nerve conduction and then drag it above sensory nerve conduction. I'm also going to move the F wave above sensory nerve conduction. So in this manner, one can easily rearrange the order of different sections in the report to obtain the necessary appearance and layout of the document. Let's now look at the waveforms. The waveforms can be transferred into the report manually, or they can be transferred automatically. The nerve conduction waveforms are usually transferred automatically. EMG waveforms are often transferred manually whenever needed. In this layout, they will appear at the end of the report, as we saw in the sample report that I showed at the beginning of the video. Some laboratories like to have the waveforms and the tabulated data close to each other. This effect can be obtained by turning on the graphs and waveform setting in the body of the test. Let us look at an example of such report. So here is a report once again with the page header at the top, followed by the report header file, patient information, visit information, automatic summary, conclusion. Then we have the tabulated data for the sensory nerve conduction and the waveforms from the sensory nerve conduction. There is motor nerve conduction table with waveforms from the motor nerve conduction study. It is not necessary or mandatory to have waveforms in the report. It's a user-defined setting and it is discussed in a separate video. Having made the necessary change to the report structure, click on OK. These settings will be applied to the subsequent patient studies. The previous reports are not affected.